High blood pressure is often called the silent killer, and for good reason. It doesn't cause pain, it doesn't show obvious symptoms, and for many seniors, it quietly builds over time until a serious event like a stroke or heart attack brings it to light. But what makes it even more dangerous is how easy it is to overlook the habits that contribute to it. Every day, simple choices, what you eat, how you move, how you manage stress, influence your blood pressure more than you might realize. The truth is, many people over 50 are doing all the right things on the surface. They take their medication, they go to checkups, they try to stay active. But hidden within their routines are small, often invisible mistakes. Habits that seem harmless but steadily push blood pressure higher or interfere with treatment. And unless someone points them out, they continue unchecked, quietly putting strain on the heart, the brain, and the entire circulatory system. That's why this video matters. We're not here to overwhelm you with medical jargon or shame you for doing things wrong. We're here to give you clarity, to shine a light on the most common blood pressure mistakes seniors make, and offer simple, practical changes that can make a real difference. Whether you've been managing hypertension for years or you've just started paying attention to your numbers, this guide is designed to help you take back control of your health in a way that feels doable, encouraging, and smart. Because blood pressure management isn't just about numbers on a screen. It's about staying active, thinking clearly, sleeping well, and enjoying life with confidence. And that starts with knowing what to avoid and what to do instead. So let's dive into the first blood pressure mistake and start building a stronger, more stable foundation for your heart health, one smart habit at a time. Mistake number 1. Skipping medications or taking them incorrectly. Managing blood pressure often starts with a prescription. And while medications are one of the most effective tools we have for keeping those numbers under control, they only work if they're taken correctly and consistently. One of the most dangerous and unfortunately common mistakes seniors make is skipping doses, taking pills at the wrong times, or stopping medication altogether without medical advice. It's a habit that seems small in the moment, but can have serious consequences over time. There are many reasons this happens. Some people forget. Others feel fine and assume they don't need the medicine anymore. Some worry about side effects, or they dislike the idea of depending on a pill. Still others cut pills in half, or take them every other day to stretch a prescription or save money. And while all of these decisions may feel understandable, they can lead to blood pressure fluctuations that strain the heart and increase the risk of stroke, kidney damage, or heart failure. Blood pressure medication is carefully calibrated for your body. It's not just about reducing a number, it's about protecting your entire cardiovascular system. When doses are missed or taken irregularly, blood pressure can spike without warning. That rise might not feel like anything at first, but over time, it quietly damages arteries and places more pressure on vital organs. And because symptoms are rare, many people don't realize anything's wrong until a crisis occurs. What's especially important to understand is that blood pressure medications often don't produce a feeling of wellness the way other medications might. You don't necessarily feel better after taking them, and that can make it easy to underestimate their importance. But behind the scenes, they are doing critical work, easing the pressure on your heart, improving circulation, and reducing your risk of life-altering complications. The good news is, this mistake is completely preventable. The first step is to make medication a routine, not a question. Take it at the same time every day, using reminders like pill boxes, alarms, or daily checklists. If you ever miss a dose, don't double up without asking your doctor. Call and ask for guidance. And if you're experiencing side effects, bring them up right away. Often, there are alternative medications or adjusted dosages that can help you feel better without risking your heart health. Also, never stop taking your blood pressure medication just because your readings look normal. That's often a sign the medication is working, not a reason to stop. Always consult your doctor before making any changes, no matter how small. Even small adjustments in timing or dosage can impact how well the medication works. It's also worth discussing affordability concerns with your healthcare provider. Many seniors try to stretch prescriptions because of cost, but there are often generics, discounts, or assistance programs that can help. Your health is worth the conversation. Managing blood pressure is a long-term commitment, but it's one that gives you more energy, stability, and peace of mind. And it starts with consistency. One pill, one day, one decision at a time. Your heart is counting on you to stay on track, and so is your future. Mistake number 2, eating hidden sodium. You may not be reaching for the salt shaker at every meal, but that doesn't mean you're avoiding sodium. In fact, most of the salt in a senior's diet doesn't come from what's sprinkled on top. It's hidden inside the foods we eat every day. And one of the most common and overlooked mistakes in blood pressure management is underestimating just how much sodium is sneaking into your meals. High sodium intake is directly linked to high blood pressure. Salt causes the body to retain water, which increases the volume of blood in your vessels and puts extra pressure on artery walls. Over time, that pressure wears down the heart and can lead to stroke, heart attack, kidney damage, or other serious health problems. But because the effects are silent, it's easy to dismiss and even easier to forget where salt is hiding. Packaged foods, canned soups, sauces, frozen dinners, breads, deli meats, and even seemingly healthy options like low-fat salad dressings or whole-grain crackers can all be packed with sodium. It's added not just for flavor, but for preservation. Many items labeled as light, diet, or heart-healthy may still contain high amounts of salt for shelf life and taste enhancement. And when these foods become staples, because they're easy, convenient, or taste familiar, sodium can add up fast. For seniors, this issue is even more critical. As we age, our kidneys become less efficient at filtering sodium, and the body becomes more sensitive to its effects. That means even moderate sodium intake can lead to bigger increases in blood pressure than it might have decades earlier. It also increases fluid retention, which can worsen conditions like swelling in the legs or congestive heart failure. The first step to correcting this mistake is awareness. Start reading labels, not just for calories or fat, but for sodium. You'll be surprised at where it's hiding. A single serving of canned soup can have more than half your daily recommended sodium. Even a slice of bread or a serving of cereal can contribute significant amounts if consumed regularly. Aim for products labeled low sodium, less than 140 milligrams per serving, or no added salt when possible. Practical steps can also make a big difference. Rinse canned beans and vegetables to wash away excess sodium. Choose fresh or frozen foods without sauces. Cook more meals at home where you control the ingredients. Use herbs, spices, lemon, vinegar, garlic, or pepper to add flavor without salt. Over time, you'll find these options not only protect your heart, but actually enhance your meals. And yes, retraining your taste buds takes time. If you've relied on salty foods for years, lower sodium options may seem bland at first, but your palate adjusts. Within weeks, you'll start to taste the natural flavors of foods more clearly, and you may even find that highly salted foods become too intense or unpleasant. Cutting back on sodium doesn't mean giving up enjoyment. It means choosing a path that supports your health, protects your heart, and helps you live with more clarity, energy, and stability. Every bite becomes a step toward balance, and every meal becomes an opportunity to nourish not just your hunger, but your well-being. Mistake number 3, not monitoring blood pressure regularly. Blood pressure isn't something you can feel, at least not until it's dangerously high or causes a serious event. And that's what makes it so deceptive. You could be going about your day, feeling fine, even healthy, while your blood pressure quietly rises. For seniors, one of the most common and risky mistakes is not checking blood pressure regularly or relying solely on annual doctor visits to keep tabs on it. Without consistent monitoring, small changes go unnoticed, and those small changes can lead to big consequences. The reality is, blood pressure is constantly shifting throughout the day based on everything from stress and sleep to what you've eaten and how active you've been. A single reading at the doctor's office, even if it's perfect, doesn't tell the full story. And in many cases, those clinic readings can be falsely high due to nerves, or falsely low if you're having a good day. That's why at-home monitoring is so powerful. It gives you a more complete picture of your blood pressure trends over time, and that insight could be life-saving. When you don't track your blood pressure, you miss valuable clues. Maybe your medication isn't working as well anymore. Maybe a new food habit or stressor is starting to take a toll. Maybe a supplement you added to your routine is interfering with your prescription. Without regular readings, you're left guessing, and when it comes to your heart, guessing isn't good enough. Monitoring your blood pressure at home is one of the simplest and most empowering habits you can build. It allows you to spot patterns, catch spikes early, and give your doctor the data they need to make better decisions. It also helps you take ownership of your health. You're not just waiting for results, you're actively shaping them, one reading at a time. You don't need fancy equipment or medical training. Today's home monitors are affordable, easy to use, and often come with large, readable displays and built-in memory. The key is consistency. Pick a time of day, like first thing in the morning or early evening, and measure it at the same time daily. Sit calmly for 5 minutes beforehand, rest your arm on a table, keep both feet flat on the floor, and avoid talking during the reading. Doing this every day builds a clear, honest picture of how your body is functioning. It's also important to keep a log, whether on paper or using an app, and bring it to every doctor's visit. This kind of record makes your appointments far more productive, allowing your healthcare provider to spot changes, adjust medication if needed, or catch warning signs early before they turn into serious problems. Some people avoid monitoring because they're afraid of what they'll find. They worry a high number will create stress or anxiety. But the truth is, ignoring your blood pressure doesn't protect you. It just gives potential problems more time to grow unchecked. Awareness is the first step toward improvement, and with blood pressure, early detection is everything. Checking your blood pressure isn't just a task to cross off a list. It's an ongoing conversation with your body. And like any good conversation, it works best when it happens regularly, calmly, and with care. Make it part of your daily rhythm. Make it a habit. And most importantly, make it a priority, because your future depends on the choices you make today. Mistake number 4, letting stress go unmanaged. Stress isn't just something you feel, it's something your body carries. And while we often associate high blood pressure with poor diet or lack of exercise, one of the most underestimated contributors is chronic, unrelieved stress. For seniors, letting stress go unmanaged is a mistake that not only affects mood and sleep, but quietly and consistently pushes blood pressure higher, day after day. Stress activates the body's fight-or-flight response, flooding the system with hormones like adrenaline and cortisol. These chemicals temporarily raise blood pressure by tightening blood vessels and increasing heart rate, a normal, short-term reaction. But when stress becomes a daily habit instead of an occasional event, your body starts to stay in that heightened state. Your arteries remain constricted, your heart works harder. And over time, that ongoing pressure creates damage that medication alone can't always fix. The tricky part is that stress often hides in plain sight. It doesn't always show up as panic or outbursts. Sometimes it's subtle, tension in the shoulders, a tight chest, a restless night's sleep, or a quiet feeling of being overwhelmed. And because many seniors come from generations that were taught to push through or stay strong, it's easy to downplay these feelings or ignore them altogether. But ignoring stress doesn't make it go away. It just gives it more time to settle into your system, draining your energy, shortening your patience, and quietly spiking your blood pressure. The good news is, managing stress doesn't require drastic changes or expensive therapies. It starts with small, intentional actions that calm the nervous system and bring you back into balance. Deep breathing, for example, slows the heart rate and relaxes blood vessels. Gentle movement like walking, yoga, or stretching releases tension and stimulates mood-lifting endorphins. Quiet time in nature, listening to music, or practicing gratitude through journaling or prayer can also reset the stress response. Even talking to a friend or simply expressing your emotions can lighten the mental load. The key is to build a habit of daily stress care, not just reacting when things get tough, but creating routines that give your mind and body space to unwind. Think of it like brushing your teeth. It's not just for when things hurt. It's for keeping problems from starting in the first place. And if you've been living with unmanaged stress for a long time, be kind to yourself. This isn't about blaming. It's about recognizing where change is possible and taking one small step at a time. You don't have to fix everything overnight, but when you begin making space for calm, for reflection, for care, your body responds, not just in your mind, but in your blood pressure, your sleep, your digestion, and your overall sense of peace. Stress may be invisible, but its effects are very real, and the power to manage it is always within reach. One breath, one walk, one moment of stillness at a time. Mistake number 5, ignoring physical inactivity. When it comes to managing high blood pressure, what you don't do can be just as important as what you do. One of the most overlooked, yet most impactful mistakes seniors make is ignoring physical inactivity. In other words, sitting too much, moving too little, and assuming that rest is always the best medicine. While rest has its place, a lack of movement can slowly, quietly push blood pressure higher and make the heart work harder than it needs to. Physical activity helps regulate blood pressure by strengthening the heart. A stronger heart pumps more blood with less effort, which reduces the force on your arteries and helps keep your numbers within a healthy range. Exercise also improves circulation, reduces inflammation, supports weight control, and lowers stress, all key factors in cardiovascular health. But when movement disappears from daily life, the body starts to lose its efficiency. Muscles weaken, circulation slows, and pressure inside your blood vessels begins to rise. For many seniors, the challenge isn't motivation, it's uncertainty. Concerns about joint pain, fatigue, or fear of falling can make the idea of exercise feel intimidating. But physical activity doesn't have to be strenuous to be effective. Even light movement, done consistently, can produce real benefits. A daily walk around the block, stretching in the morning, or gentle chair exercises in front of the television can all help get the heart pumping and the blood flowing. In fact, one of the most powerful changes you can make is simply to sit less. If you tend to watch TV or read for long stretches, try standing up every 30 to 60 minutes. March in place for a minute. Walk to the kitchen. Do a few shoulder rolls or toe taps. These short bursts of movement throughout the day help break up long periods of sitting, which can otherwise stiffen arteries and raise blood pressure over time. What matters most is consistency. Moving your body regularly tells your heart, your blood vessels, and your brain that you're still engaged with life, still active, still strong. And over time, that message becomes reality. It's also important to find forms of movement you enjoy. That might be dancing, gardening, water aerobics, or a simple stretching routine in the morning sun. When exercise feels pleasant, not punishing, you're more likely to stick with it. And the more it becomes a habit, the more your body begins to thrive. If you're unsure where to start, talk to your doctor or a physical therapist. They can help you find safe, appropriate ways to move based on your current health and mobility. Remember, this isn't about becoming an athlete. It's about staying independent, keeping your balance, and giving your heart the help it needs to serve you for years to come. Ignoring inactivity may feel harmless, but over time it places unnecessary pressure on your heart and blood vessels. Movement is medicine, and every step you take is a step toward lower blood pressure and a stronger, more confident you. Mistake number 6, overusing caffeine or alcohol. A cup of coffee in the morning, a glass of wine at dinner. These small comforts are part of daily life for many people, and in moderation, they can be just that, comforting. But for seniors managing high blood pressure, overusing caffeine or alcohol is a mistake that often flies under the radar. These substances don't seem dangerous in the moment, but they can quietly raise blood pressure, interfere with medications, and create more health challenges than they solve. Let's start with caffeine. Found in coffee, tea, soft drinks, energy drinks, and even chocolate, caffeine is a stimulant. It narrows blood vessels and increases heart rate, both of which can temporarily elevate blood pressure. For some people, this effect is minor or short-lived, but for others, especially those already dealing with hypertension or heightened sensitivity to stimulants, even a small dose of caffeine can push blood pressure into the danger zone. What's tricky is that the effect varies greatly from person to person. Some seniors can enjoy a daily cup of coffee without issue, while others may experience spikes that last for hours, sometimes without even realizing it. The key is awareness. If you drink caffeine regularly, it's worth paying attention to how your body responds. Consider checking your blood pressure before and after your morning brew or afternoon soda. If you notice a pattern of higher readings or symptoms like headaches, jitteriness, or a racing heart, it might be time to cut back or switch to decaf. You don't have to give up your favorite rituals entirely. Just make thoughtful adjustments that support your heart. Alcohol presents a different kind of challenge. In small amounts, it may seem to help with relaxation, lowering your guard at the end of a long day. But in larger or more frequent doses, alcohol raises blood pressure and can interfere significantly with the effectiveness of medications used to treat hypertension. It also contributes to dehydration, poor sleep, weight gain, and increased emotional stress, all of which negatively affect blood pressure. For seniors whose bodies process alcohol more slowly, these effects can be magnified and linger longer than expected. Drinking more than one alcoholic beverage per day can begin to shift the balance from occasional indulgence to chronic risk. And combining alcohol with blood pressure medications can lead to a range of side effects, including dizziness, confusion, and liver strain. These risks are even greater when other medications are in play, which is often the case for older adults managing multiple conditions. The good news is that moderation, even small reductions, can make a noticeable difference. Cutting back on caffeine or alcohol can lead to lower blood pressure readings, better sleep, more stable energy levels, and improved focus. In some cases, reducing these substances can also reduce the need for additional medications. And giving up coffee or wine doesn't mean giving up comfort. There are plenty of enjoyable, heart-friendly alternatives. Try herbal teas like chamomile, mint, or rooibos. Sip on warm lemon water or make your own flavored sparkling water with fresh fruit and herbs. These simple swaps can offer the same sense of ritual and relaxation without the side effects. Ultimately, it's not about restriction. It's about intention. Knowing how caffeine and alcohol affect your body empowers you to make better choices. Choices that support not just your blood pressure, but your overall health and quality of life. Your heart doesn't ask for perfection, it asks for care. And each step you take toward balance is a step toward a stronger, steadier you. Mistake number 7, not communicating with healthcare providers. When it comes to managing high blood pressure, having the right support system is just as important as taking the right medication or eating the right foods. And at the center of that support system is your healthcare provider. Yet one of the most common and avoidable mistakes seniors make is not keeping the lines of communication open with their doctor or care team. Whether it's skipping appointments, holding back on symptoms, or assuming things are good enough, a lack of honest, regular dialogue can lead to missed opportunities and missed warning signs. It's easy to fall into a routine of simply renewing prescriptions and showing up for annual checkups. But blood pressure isn't a set-it-and-forget-it condition. It fluctuates with changes in stress, activity level, sleep, diet, other medications, and even the seasons. If your doctor isn't fully informed about how you're feeling or what's happening day to day, they're working with half the picture, and that can make it harder to catch problems early or fine-tune your treatment. Many seniors hesitate to speak up out of fear of seeming difficult, being judged, or bothering the doctor. But no concern is too small if it relates to your health. Whether you're experiencing unusual dizziness, a side effect that you've been trying to ignore, a new supplement you've started, or a recent change in your routine, all of this information helps your provider keep your care plan safe and effective. Medication side effects in particular are one of the most underreported issues. Some people simply stop taking their pills because they don't like how they feel, but they never mention it to their doctor. This can lead to uncontrolled blood pressure or worse, serious complications. A quick conversation could result in an adjusted dosage, a different medication, or lifestyle changes that make a world of difference. Blood pressure readings at home should also be part of your communication. Bring your log to your appointments or share it through a patient portal if available. Seeing the trend, not just a single reading, allows your provider to understand what's working and what isn't. And if readings are inconsistent, they can help you figure out why. Even mental and emotional health matter in this conversation. Stress, loneliness, depression, and anxiety can all contribute to rising blood pressure, and your provider may be able to refer you to counseling, support groups, or community programs that can help. If visiting the clinic is difficult due to mobility issues, distance, or transportation concerns, ask about telehealth options. Many practices now offer virtual appointments that make it easier to stay in touch without leaving home. Good communication doesn't require long conversations, just honest ones. Your doctor is your partner in health, not a judge. The more they know, the better they can guide you. And you don't have to wait until your next appointment. If something feels off, or if you're unsure about a reading, a side effect, or a lifestyle change, reach out. Your health isn't a solo project. It's a collaboration. And keeping those conversations open is one of the smartest, simplest things you can do to protect your blood pressure and your future. Managing high blood pressure doesn't have to be overwhelming. It doesn't require a perfect lifestyle, an endless list of restrictions, or constant worry. What it really requires is awareness of the daily habits that matter, the signals your body is sending, and the power you have to shape your health one decision at a time. The truth is, blood pressure isn't just a number. It's a reflection of how your body is living, breathing, resting, moving, and responding to life around you. Now you've seen the 7 most common mistakes that often go unnoticed, and more importantly, you've learned how to avoid them. From understanding your medications to watching your sodium, staying active, managing stress, communicating with your healthcare provider, and making mindful choices about caffeine and alcohol. These are all manageable, realistic changes that don't require you to overhaul your life. They simply ask you to care for yourself with a little more consistency and a little more intention. At NutriHub Bliss, we believe that good health is built one habit at a time. You don't have to do everything at once. Just pick one area to start. Maybe it's checking your blood pressure regularly, or swapping a salty snack for a fresh one. Maybe it's setting a reminder to take your medication on time, or calling your doctor about something that's been bothering you. Whatever it is, know that every small step you take is a step toward a healthier heart, a steadier life, and a stronger you. If you found this video helpful, give it a like, subscribe, and share it with someone who could benefit from a little clarity and encouragement. Because when we support each other, we all rise, stronger, steadier, and better equipped to thrive, one heartbeat at a time.